Good morning, dear students. In continuation of our previous class regarding general anatomy of bone, we are in the second part. We will continue today with the bone growth and the ossification. Now, before starting on to our today's presentation, where we will cover the ossification, parts of growing long bone and bone growth. A little bit recap of our previous class. Remembered in your own mind, we have said the characteristic of bone as a sclerous tissue, functions of the bones that is performing in different regions of your body, gross structure of the bone, the periosteum, and the classification along with examples of the different types of the bones. Now, what does this word ossification mean? As previously we have said that there are two terms in sclerous tissue or formation of the sclerous tissue from the embryonic mesenchymal cells. Now to say about the mesenchymal cells, these are the cells developed from the mesoderm. You will know in details in your embryology classes. And these are the multipotent cells, origin to the cells of the connective tissue and so also others. So two terms, one is chondrification, that is formation of cartilage. After that, in the basic cartilaginous or membranous model, there is starting of the ossification, that is bone formation. So by the term ossification, we means bone formation. So for the bone to form a basic model of any cartilaginous structure, mainly the hyaline cartilage, or any membranous model is required. And onto the surface of those models initially, areas develop where the mesenchymal stem cells do differentiate to form the osteoblasts. And these osteoblasts gradually do develop to form the osteocytes, osteoclasts, etc. And bone formation progress. So this whole formation of the bone via proliferation of the bone cells, their conversion to mature bone cells, that is osteocytes, remodeling of the developed bone via the osteoclasts, along with the intercellular deposition of the matrix and its calcification via deposition of calcium phosphate salts. So that is a combined procedure, is known surmountedly to be the ossification. The area where it starts first is known as the ossification center. Now the ossification center are of two types. One is primary and one is secondary. Now in embryonic life, via the proliferation of the same mesenchymal cells, a basic model of membrane or cartilage, mainly of hyaline cartilage covered by perichondrium, is laid down onto the different parts of your developing embryo. And in those developing cartilaginous model or membranous model, first there is appearance of a ossification center in the embryonic life. And the process of ossification begins. So those centers that starts ossification in these models in embryonic life are known as primary ossification center. And some of the areas of those cartilaginous model develop another or additional ossification centers after birth. And these centers are known as the secondary ossification centers. Now to say about the primary ossification center, it will take a basic model of a long bone. So this is the first perichondrial covered cartilaginous model, where because of establishment of the vascularity, the ossification starts. and the ossification center first appearing onto the shaft region for the growing long bones, and these are developing before birth. So these are the primary ossification center. So from the primary ossification centers, the shaft of the bone or the long bones are developing. Later, after birth, in later ages, at the ends, additional ossification centers do also appear, and they are known as the secondary ossification centers. Now, these two, that is, the primary and the secondary, both ossification centers to contribute to form the adult configuration of the bone. All the primary ossification centers appearing before birth. Only exception is that the primary ossification center for the carpals and the tarsals, they are also to appear before birth, but in case of calcaneum, talus, and cuboid, these are the only small bones where the ossification center appeared before birth. But the primary ossification center for the other carpals and tarsals appear after birth. Though they are primary, but their ossification centers are appearing after birth. This is an important exception, and you must have to remember this. Coming to the secondary ossification center, as I have said, these are the additional centers mainly at the end of the long bones from where the additional parts of the bones do develop. And these are the ossification centers appearing after birth. There is also an exception to this. If you will see the ossification center at the lower end of the, this is a model of the developing femur. If you see the ossification center at the lower end of the femur, so also in some cases upper end of tibia, these are the secondary ossification centers, but these are seen to arise before birth. These are the examples of the secondary ossification centers appearing before birth. And it is a very important applied part. Previously, in old ages, when the ultrasonography or other modern investigation procedure was not there, X-rays was done to delineate the maturity of the developing fetus. And in those cases, the baby inside the mother womb who have shown the appearance of this ossification center at the lower end of femur and upper end of tibia was said to be mature. Actually, it was not a routine done in some medical legal cases, whether the baby inside the mother womb was a mature baby or an immature baby. To know that previously, very much previously, it was done. And must remember that nowadays, doing X-ray until it is an utmost emergency is strictly prohibited in case of pregnant. In the process of ossification, what happens? The facts are differentiation of the osteoblast. Osteoblasts do proliferate in huge number. In the second form, the osteoblasts do secrete intercellular substances, including the collagen fibers, which will strengthen up the intercellular matrix. And in the intercellular matrix, there is calcification. That means deposition of calcium phosphate to make the developing bone rigid and hard. So all these three procedures together is known as ossification. Thus, calcification is a part of the ossification. Calcification itself does not mean the ossification. Ossification is bone cell proliferation, differentiation, intercellular matrix deposition or secretion via the osteoblasts, along with calcification of that intercellular matrix. And these three factors together will lead to formation of bone. That is ossification. Now, depending on where the ossification is being started, it may be membranous ossification, where the basic model is a membrane, and it may be cartilaginous ossification, where the basic model is a cartilage. in the form of membranous ossification. It mainly occurs in case of flat bones, the bones which are covering the vault of your skull, scapular blade, like that. So in these bones, first there is a membranous model. Onto one area over the membranous model, mesenchymal cells differentiates to form the osteoblast. And this is the ossification center. Now, osteoblasts secrete collagen fiber and intercellular substances. As they do secrete these substances, they will deposit them surrounding developing osteoblasts. And as they are deposited all its surrounding, forming different lamellar organization of intercellular substances, then what happened? The center part of the cells, that is the osteoblast, is now converted to osteocytes. And at the periphery, they are again proliferating in a radiating manner. See the coming picture. This is the start point of the ossification in a membranous model. The center cells are getting converted to osteocytes via deposition of intercellular substances surrounding them, and the peripheral cells do still continue to proliferate. Then, because of the vascularization, the cells from the ossific center do proceed in a radiating manner so that the area of bone formation will go on enlarging. Osteoblast to osteocytes plus deposition of the intercellular matter and their calcification. It will lead to bone formation, and this way the entire model will get converted to a bony model. And this form of ossification is known as the membranous ossification. See, this way the bony lamellar deposited forms compact bone onto the surface, that is the convex surfaces of the skull bones, and one compact layer of bone outside, one compact layer of bone inside, in between them, spongy bones having the diploe and the bone marrow. And what happens in a skull till the period it grows via appositional method, one at the outer surface or the outer convex surface and one at the suture line. This is the another pictorial representation of the membranous ossification. This is the area where the ossification has started. As soon as this big osteoblast after proliferation is going on to the surrounding, the center ones is converted to osteocytes. And this is deposition of the intercellular matrix, which will get calcified. And this way, the ossification center will proceed in its surrounding, and they will form bone in different directions in the spokes of the wheel, so also inside. And this way the ultimate configuration of the spongy bones inside the two layer of the compact bones, one underneath the outer layer of the bone covering, that is periosteum, and one inside the bony covering, that is endosteum. So this is almost the adult configuration of flat bone, having two layers of the compact bone onto its two sides. And this you can see the sponge-like appearance of the spongy bone area. In case of skull bone, this space is known as diploe, loaded with blood vessels and bone marrow. Now to say about the cartilaginous ossification, first we have to say a little bit of the two slides that we have already studied in cartilage. In the histogenesis of the cartilage, you have known about that undifferentiated mesenchymal cells do differentiate to form the chondroblast. Chondroblast increase in size, secrete intracellular substances around them, and convert it to chondrocytes. Same way the osteoblast do. Cartilage grows in size via positional and interstitial two methods. Then the chondrocyte secretes phosphorylase and alkaline phosphatase. Glycogen stored inside the chondroblasts convert sugar to sugar phosphate by the process known as phosphorylation, and the enzyme involved is phosphorylase. After that, alkaline phosphatase present in the same chondroblast, they hydrolyzes the sugar part of this sugar phosphate, and now the phosphate ion is released. And these phosphate ion will combine with the calcium to form the calcium phosphate, and that is the process of calcification. Now, in the calcific matrix, the cartilage cells die, matrix weakens. In that preliminary formation, the bone cells invade with vessels to set the ossification. Now get into the same thing. Here you see a model first. This is the cartilaginous model, preliminary in embryonic part or in embryonic life of developing long bone covered by the perichondria. And within the cartilaginous model, some cells are in the process of proliferation. They do increase in number and proceeds to the periphery. Some cells are in the process of maturation. Center cells, where from the in fact proliferation had started, it proceeds from the center to the periphery or towards the end. The center cells, because of the process of their secretion of intercellular substances, so also their calcification, they do die. Form small vacant spaces known as the areolae. And this is the primarily formed vacant spaces. So these are the known as the primary areolae. In this stage, because of establishment of vascularization into the cartilaginous model from its surrounding first, and it will invade the cartilaginous model to proceed the ossification. So first, as soon as there is establishment of the vascularization in the cartilaginous model, the mesenchymal cells do differentiate to form the osteoblasts. And these osteoblasts surrounding the vascular model will proceed underneath the perichondrium, which is now changing its name to periosteum. At the same time, it will invade inside this mature calcified layer of the cartilage cells, forming the areolae or the primary areolae. Now see, this is a collar of the osteoblast having the osteoclast at its end. Osteoclasts are the bone breaking cells. So they will break the calcific matrix that are formed surrounding the primary areolae, and it will invade inside, breaking this way. So simultaneously, this 1, 2, 3 primary areolae will merge with one another to form the secondary areolae. And these osteoclasts will do the function. Osteoclast, they are also bringing with them surrounding the invading blood vessels, and these invading blood vessels are the future nutrient artery for the developing long bone. Surrounding the blood vessels, osteoblast cells also goes in. They do differentiate, they do proliferate, and they will proliferate in directions, one above downwards and one in front. So in the ultimate configuration, the vessels going inside the cartilaginous model, now gradually converting to bones. Okay, and even inside this center areolae to merge with one another to form a big one or a bigger one to form the marrow cavity. And surrounding the marrow cavity, because of this invading of the blood vessels along with the osteoblast surrounding them, they will form trabecular bones. And the osteoblast lying in the surrounding underneath the perichondrium, now converted to periosteum, is going to form the Haversian system to form the cortical part of the bone. So this is the ultimate configuration of an adult bone. It will give the appearance like this, that at the compact part, you have the Haversian system that will be taught to you in details in coming lecture. And in the center, there are the spongy bone with the, at the center, there are the spongy bones and with the vacant space inside that is known as the bone marrow cavity. And these are the sites of penetration of the vessels, which will ramify inside the compact bone, so also inside the spongy bone, reaching up to the bone marrows. And this is the future nutrient artery. So, what we have just studied, let's recap. Cartilaginous ossification starts in a hyaline cartilaginous model covered by perichondria. Clear? Mesenchymal cells differentiate to form the first hyaline cartilage model, which grows in length via interstition and in gut via apposition. True. Within the cartilaginous model, there are the zones of proliferation at the periphery, then the maturation, then zone of hypertrophy, and then zone of calcification at the center. Hypertrophic cells die and leave the vacant space known as the primary areola. Simultaneously, the perichondrium is vascularized on its inner layer, differentiates into to form the osteoblasts, and the perichondrium is now converted to periosteum. And these are the simultaneous procedure via which configuration of the diaphysis of the long bone is developing. It will again get clear in our next presentation of the architecture of the diaphysis. In gist to say about, this is the cartilaginous model, establishment, formation of the primary areolae, establishment of the vasculature. Then first ossification starts. Thereafter, it proceeds on to either direction, primary areolae, secondary areolae, to merge with one another longitudinally to form a cavity inside the long bone, that is the bone marrow cavity. It's a very vascular, containing the bone marrow. And at the ends, it is lying the spongy bones. So also the outer lining of the bone marrow is covered by the spongy bones, where the periosteal collar of the bone forming the compact bone with the architecture of the Haversian system. So this is the adult configuration of the bone. And in the process, additional centers do appear to contribute to the bone configuration. These are the secondary ossification center at the region of the epiphysis, and ultimately fusion of all of this will give the adult configuration of the bone. And whenever the processing of the bone formation, any spicules, any additional bone that is growing inside the cavity or outside, they are being cleared via the osteoclast cells. Now, the second topic of the parts of growing long bone. A growing long bone, you can think it to be any of the long bones lying in your extremities. Suppose we are saying of the humerus, or we are saying of the femur. Then any of these long bones have these four parts. The end part are the epiphysis, and the part lying between the epiphysis is the diaphysis. The part of the diaphysis which is lying nearer to the epiphysis is the metaphysis. And in between the metaphysis and the epiphysis lies the growth plate or the cartilage plate, which is known as the epiphyseal cartilage. See here, the word physis meaning to grow. From there, the word has came physis, and dia means to grow between. So it is the part between the ends of the long bone. So this part from where the shaft of the long bone will develop is the diaphysis. At the end, this part are the epiphysis. The part of the diaphysis nearer to the epiphysis is the metaphysis. This is the metaphysis zone. And in between the metaphysis and the epiphysis, there is a growth plate which helps the bone grow in length, is known as the epiphyseal cartilage. See the architecture. This is the shaft or the diaphysis part. The hairpin arrangement having area of the bone or of the part of the diaphysis nearer to this epiphyseal cartilage is the metaphysis. So this area is the metaphysis. This area is the metaphysis. After that, it is the bone plate. It is the epiphyseal cartilage covered by the perichondria. Secondary ossification center, from where the end part of the bones are developing except the articular cartilage, is known as the epiphysis. So this is one end, epiphysis, epiphyseal cartilage, metaphysis, and diaphysis. Same way on the other end. Epiphysis is the part which is added on, you can say, or which is lying above the diaphysis, developing from the secondary ossification center, appearing after birth. One exception in case of lower end of femur and upper end of tibia. They are secondary ossification center but appearing before birth. They are mainly formed of the spongy bone you can see inside and a layer of compact bone outside. They fuse at the region of the epiphyseal cartilage with the diaphysis. And this region is like any hyaline cartilaginous model. So it is enchondral in ossification. Now, the different types of the epiphysis is a must read with example for you. As we know, the epiphyses are lying at the end. And those epiphyses which are exposed to the pressure. And this pressure are because of mainly body weight, passage of stress and strain. So those epiphyses are exposed to this sort of pressures are known as pressure epiphyses. Mainly the epiphyses lying at the end of the long bones in the extremities are the pressure epiphyses, such as head of femur, end, that is lower end of femur, like that. Okay. Now coming to the next type of epiphysis, that is known as the traction epiphysis. Traction means to pull, and this pull are produced by attachment of some of muscle. The examples are the two trochanters in case of femur, the greater and the lesser trochanters. Atavistic epiphysis meaning to some individual bone appearing nearby the developing other major bone. And now this individual bone, because of the nutritional reason, is getting attached to the surrounding big bone, such as this is a beak-like coracoid process of the scapula. Onto its tip, there is another bone, that is a tip of the coracoid process, which was previously an individual bone getting attached as per development for the nutritional reason. So also the posterior tubercle at thallus is again uniting with the main mass for the nutritional reason. The sort of additional epiphysis are known as the atavistic epiphysis. That means which is not actually present phylogenetically, they are a separate bone. They are attached to the main mass for nutrition reason. Coming to the aberrant epiphysis, by this time in the last presentation, you have known that the epiphysis in case of metacarpals are present at the head end. See, these are the epiphysis still has not fused with the shaft. Okay, and in case of first metacarpal, what do we say? That the epiphysis is lying at its base. But in some reasons, some additional epiphysis may appear in these regions, such as see here at the head of the first metacarpal. Okay, for the first metacarpal, it should be only at the base, but an additional one has appeared in its head. So also an additional one can appear in the base of the other metacarpals also. An epiphysis which is not expected to lie in normal situation, but it's lies or it appears for some special reasons of our body. So that sort of additional epiphysis is known as aberrant epiphysis. Okay. Now again, the epiphysis can be said in two forms: simple epiphysis, where a single mass of bone appearing as a cartilage, developing into ossification, and then merge with the main bone, 1 to 1. So that is a simple epiphysis. But in some cases, such as at the upper end of humerus,
there are appearance of three separate epiphyses, one for the head, one for the crater, and one for the lesser tuberosity at the upper end of the humerus. They are appearing at different age of almost 135, but they merge with one another by the age of 6 years, as if they are acting as a single epiphysis. Though appearance-wise, they are three separate epiphyses. But before fusion with the main mass of the shaft of the humerus, they do fuse with one another as a single mass by the age of 6 years and then fuse with the main mass. So that sort of epiphyses, which are not individually merging with the main bone, but they are meeting with the adjacent one to form one single structure and then meeting with the main bone. That sort of epiphysis is known as compound epiphysis. Now, there is very interesting time known as apophysis. Apo means additional to. Normally, because of development present at the surrounding of some bones, some additional ossification centers appear. Okay, and that are not normally present in every individuals. But gradually, these bones sometimes get fused with the main surrounding mass. This type of epiphysis is known as the apophysis. It may appear in case of adults, and you can see that this part was not expected here. So some person will take it to be a fracture. So that is a misleader. This is the growth plate. How the growth at the epiphyseal region will occur. See here, if this is the region, this is a pictorial representation of the epiphyseal cartilage. This part is the metaphysis, that is the upper part or end part of the diaphysis nearer to the epiphyseal cartilage. In the epiphyseal region properly, there are different zones of cells. Some cells nearer to the metaphysis, they as grow and the cartilage cells do convert to chondrocytes. There are formation of cartilaginous matrix by which these cells die from areolae, and these areolae do merge with one another, which in this situation get vascularized by the vessels coming from the region of the metaphysis, and surrounding which the same way osteoblast will deposit bone and the spongy bone at the end will form. This way it will proceed onto the nearer to the end, and gradually this cartilaginous part is converted to bone. In the zone of the growth plate, you do have the next zone, that is the maturation zone or hypertrophy cells, where the chondroblasts lying in hypertrophic form. Then there is zones of proliferation, where the cells are proliferating in huge number, so they will encroach. Okay, they will enlarge, and these are the reserve zone. Beyond it, it is the epiphysis proper, and this is the whole of the epiphyseal cartilage. So gradually, the new cells of the chondroblast will proliferate and will proceed towards the epiphysis, and from the metaphyseal end, this cartilage is converted to bone. So gradually, the cartilage, epiphyseal cartilage, where proliferation will increase in size and it will be converted to bone, bone-wise. So ultimately, the bone will grow in length, and that sort of growth is known as as it is coming from inside. So that is known as the interstitial growth. Interstitial growth. Now, it is very important that this region, that is the epiphyseal cartilage, is the main growth plate of the developing or growing long bones. But because of some reasons, mainly in case of children, they are very naughty playing every time, this cartilage zone may be damaged, okay, or ruptured. So what will be the effect? Initially, the effect will be pain, swelling in the lower region, and if it is not properly taken care of and this cartilage is severely damaged, so what will happen? that end of the long bone will not at all grow properly. Okay, it may grow abnormally. Some area is growing more, some area is growing less, or not at all growing in any direction. So such a classification about the injury of this epiphyseal cartilage is Salter-Harris classification. This is the normal configuration at the end of the long bone. This is the epiphysis, diaphysis, and between them the epiphyseal cartilage. In the first type, only there is separation of the epiphyseal cartilage. So the cells are getting away from one another, creating vacuum. There may be fracture of the epiphyseal cartilage, and the fracture line is also proceeding above, A for above, through the diaphysis. In the third type, it is proceeding lower one through the epiphysis. And in the fourth type, it may proceed either ways. And in fifth type, there is total crush injury of the epiphyseal cartilage. If any of this is occurring and not properly taken care of, you can clearly think in this case, that is type 5, the growth in this region will not be further possible. So the person will have a stunted limb. Same way, if the repair and the proper treatment of this sort of fracture is not done, some part of the bone will grow more, some part will less. So there will be a mismatch in the configuration of the developing bone. And this sort of injuries must have to be taken seriously, mainly in case of children. See, this is an normal configuration of the wrist region in case of children, where this is the lower end of the radius with the epiphysis has appeared. These are the developing carpal bones. And you can see the number. There is technique by which counting the number of the ossification center appearing in the region of the carpus. The age of the child can be said here 5, so we can say roughly 5 years of age. You can see this is another ossification center not fused with the main mass. So these are the immature and growing bones. This is a picture same way of adult bone where you cannot see any of the ossification center lying separate from the main mass, all fused. Now in Salter-Harris type, you see first type there is separation of the growth plate, type 1, that whole of the epiphysis is separated from the diaphysis part. In the second type, it is fractured, along with the fractured line is proceeding to the upper part. In the third type C, along with fracture of the epiphyseal cartilage, the fracture line proceeding downwards. In type 4, the fracture line is cutting the epiphyseal cartilage, so also the developing bone in the region of the diaphysis and epiphysis through and through. And this is a sort of crush injury occurring at the region of the epiphyseal cartilage. So these are all some radiological evidences of Salter-Harris classification. To say about the epiphyseal cartilage is a plate of hyaline cartilage between epiphysis and diaphysis. It persists till the bone grows. It is replaced in adult as soon as the final fusion of or final conversion of the whole of the cartilage of the epiphyseal region is converted to bone. The adult configuration is reached. So there is certain age, which is adult age, approximately it's 18 to 20 years, by which almost all the epiphysis of the long bone does fuse, so that no more length. Okay, that is a clear cut dictum. If you will start hanging to increase your length by the age of your 40, it will never happen, sir, because your epiphysis has fused. Your bone has reached its adult configuration. Now, there are some rules about the fusion of the epiphysis, because the epiphysis appearing in case of long bones are different type. different times of life. So there are some rules for fusion of the epiphysis. First of rule is that ossification centers in the epiphysis appears earlier in female and fuses earlier too. There is law of union of epiphysis. You must have to remember every time you will read any of your bones. The epiphyseal center which appear first unite last and vice versa. Some exception for fibula will be explained along with the consequent bone. The epiphysis that unite last with the shaft is the growing end. Of course, the part that will fuse last is still growing, so that is the growing end. And the growing end are opposite to the direction of the nutrient artery. Nutrient artery is the artery which is entering the developing cartilaginous model to start vascularization, to start ossification. So there is a particular direction of the nutrient artery inside the shaft. Okay, and there is a dictum for this. The dictum is to the elbow I go, from the knee I flee. That is, the nutrient arteries lying in the superior extremity, they are directed towards the elbow. And the nutrient arteries that is entering the bones in the inferior extremity, they are directed towards the hip and towards the ankle. So you can clearly say from this that the growing end in case of superior extremity, such as humerus, the nutrient arteries towards the elbow or towards the lower end. So the growing end is the upper end or the head end. So in case of radius ulna, the growing end are the lower ends. If we'll say of the inferior extremity, as the nutrient arteries are going away from the knee, so the growing end of the femur, tibia, fibula is the knee end. Okay, must have to keep in mind and hold it because it will come repeatedly in your study. So also for your MCQ. Now bone growth mainly, remember, mainly via the appositional method. Mainly via the appositional method at the periphery. And some way via the interstitial method that is occurring at the region of the epiphyseal cartilage. So to summarize, we have studied today the parts of the growing long bone that are diaphysis, epiphysis, metaphysis, and the epiphyseal cartilage. The bone growth, how does the bone grows via positional and the interstitial method. Ossification, what is ossification, what is center of ossification, what is primary, secondary center of ossifications, how they are separate from one another, the exceptions related to appearance of these ossification centers, and how the ossification does proceed. So this much from today's presentation. In the next presentation, we will proceed with the formation of the Haversian system, factors that are affecting the bone growth, blood supply of the bones along with the bone marrows. Okay, but dear student, whenever starting any new point, I request you, please revise the previous one once of the correlated topics at least. Neither that we are reading in continuity, some parts will be missing. It will be difficult for you to understand the whole fact. Okay, because this detailed way is first exposure and you have to give a little bit time in understanding. Once you understand, the study is very easy and interesting. So we will continue in our next class. For the time being, thank you. Happy learning. Have a good day.